So your research focused on KIM-1 and other biomarkers that may help predict who is at a higher risk of recurrence after surgery. How could this eventually help doctors make better treatment decisions for patients?
Yeah, so I hope that with maybe a further trial or some further investigation, we will get to a stage where we can look at a patient's KIM-1 level in that post-operative period, maybe around sort of 8 weeks after surgery, and that will help us make a decision around the treatment. So for example, a patient that's KIM-1 low, we might be able to say, well, actually, you just need observation. Whereas maybe a patient who's KIM-1 high, it might give us some reassurance that, yeah, you do need treatment, and okay, there's a risk of toxicity, but it gives some more confidence going in for those patients.
So do you see a future where blood tests can help doctors determine which patients need additional treatment and which patients don't?
Yeah, I think so. So, I really hope that we'll get to that stage in kidney cancer. So, we've got other data on KIM-1 in the advanced setting. So, others at this meeting have talked about using KIM-1 to assess how patients are responding when they've got metastatic disease. So, using it as like a dynamic marker. So, you start treatment and the KIM-1 level is coming down at week 3. So that's like great news. Let's go ahead. And there's also data on ctDNA that's been presented recently. Which has been difficult in kidney cancer, but I think the technology is improving all the time, so I think that might come through for kidney cancer. So hopefully we'll have lots of things in the toolbox that we can use for our patients shortly. Yeah.
Great. And then given all of the research that's been presented yesterday and will be presented today, what do you think has the greatest potential to improve patient care in the future?
Yeah, so I think in the short term, the new data on the HIF inhibitors is great. So we have patients in our clinic who are on those trials, and we're really excited for those agents to come through into mainline therapy as another option for our patients. But then thinking about maybe the basic science that's been presented, I really enjoyed the keynote yesterday around metabolism in kidney cancer, because I think that's maybe a missing piece in the puzzle for kidney cancer. And we know it's so important, but we haven't really been able to target it well yet. And hopefully there'll be more things to find there that will help patients in the future.